This is Dr. Bev Knox, and you are listening to my psychology tutorials. Learn psychology while you sleep.
The goals and methods of a prevention program also depends on the drug using status of those served by the program. The programs designed to prevent young people from starting smoking might be different from those used to try to prevent relapse in smokers. Until recently, drug abuse prevention programs have been classified according to a public health model. We can distinguish between education programs with the goal of imparting knowledge and preventing programs aimed at modifying drug use behavior. Most of the research over the past 40 years has failed to demonstrate that prevention programs can produce clear, meaningful, long-lasting effects on drug-using behaviors. After the increase in the use of illicit drugs by young middle-class people in the 1960s, there was a general sense that society was not doing an adequate job of drug education, and most school systems increased their efforts. However, there was confusion over the methods to be used. Traditional anti-drug programs had relied heavily on representatives from the local police who went into schools and told a few horror stories describing the legal troubles due to anyone who got caught with illegal drugs. Teachers and counselors knew little about these substances, and many teachers attended courses taught by experts. Some of these experts were enforcement-oriented, who presented the dry facts about the classifications and effects of various drugs. In the early 1970s, this model began to be questioned. A 1971 study indicated that students who had more knowledge about drugs tended to have a more positive attitude towards drug use. Of course, it may have been that pro-drug students were more interested in learning about drugs, so this was not an actual assessment of the value of drug education programs. The effective education programs of the 1970s have been criticized for being too value-free. Based on the success of the social influence model in reducing cigarette smoking, a variety of school-based programs have used the same techniques with illicit drugs. The D.A.R.E program has been adopted rapidly and widely despite research showing limited impact on drug-using behavior. Current school-based approaches use refusal skills, countering advertising, public commitments, and teen leaders. Several of these programs have been demonstrated to be effective. Other non-school programs are peer-based through after-school groups or activities, parent-based through parent and family training, or community-based. Our nation's public schools clearly are the most convenient conduit for attempts to achieve widespread social changes among young people, and that is why most efforts at drug abuse prevention have been carried out in schools. However, peers, parents, and the community at large also exert powerful social influences on young people. Because these groups are less accessible than the schools, fewer prevention programs have been based on using parents and community influences. Nevertheless, important efforts have been made in all these areas.